Good morning. This is Dr. Timothy Scott back here. It is February the 5th of 2024, and I want to say good morning to you. And I hope you have a good week, and I hope we do too. It started off busy, so we're good there. And certainly, if you're not feeling well today, come on and call us and get in here so we can get you taken care of. Okay? That's all we're trying to do, just to get you seen and taken care of. So let's talk about a few things. First of all, our initiative for this month is the wellness exams. Now, if you haven't noticed, I talk about the wellness exams a lot if you listen to my videos. But what we're going to try to do this month is slay the dragon. In other words, we're going to try to reconcile all of our wellness burdens and try to get people set up with that. We did last week. I think we scheduled 500 of them. And we've also sequestered the activity, and I've hired Kristen. A lot of y'all know Kristen. She's going to be doing the wellnesses for me from now on. So I think it's going to make it a lot easier for you, a little clearer about what's going on, and it's very distinct service. But also we're going to make sure that we're thorough and we get everything done just like your insurance company wants us to do. Okay, so yeah, the main thing with the wellnesses is we have to do them exactly to the T, exactly what your insurance company wants from us, whether it's Medicare or commercial insurance. And Kristen's mainly going to be focused on the Medicare ones. She will see some commercials, but mainly she'll be focused on those Medicare ones because those are the ones that they are constantly on us to do right and to check all the boxes and become compliant. I mean, it's an everyday feedback that we get about that. So thank you for participating. The cool thing is, I know, like I said, we scheduled 500 wellnesses the other day. I know that there's probably going to be 20 or 30 people, just roughly, that's just a rough guesstimate, who we're going to change the outcome of their life. And that's always very inspiring to me. Inspiring, okay? To be able, not expiring, inspiring to me to be able to make a significant change in somebody's life. So thank you in advance, and just work with us as we try to figure out new workflows and figure out better ways to do things, better ways to accommodate you and make sure you're okay. I just read an article in the news, on the news before I got on this video, and I thought it was a good enough article to share the premise of what it was. And it was, doctors are biased about not diagnosing females with heart disease appropriately. Now, I read the article, and some of it was a little too presumptive about what we do and don't do, okay? But we've recognized over the years that we could do a better job of detecting and responding to heart disease in women. It seems like women don't present as textbook as men, and maybe that's because they did all the research on men. I don't know. But the awareness of heart disease in women, and as you get older, it gets worse, is something that we do think about every day. And if you think you're having heart problems, always tell us, and we are going to respond. We're going to analyze your situation and try to do the best we can to respond to your concerns and give you a realistic idea about what's going on, because it's hard sometimes to figure those things out. And I've been in a room full of cardiologists, experienced cardiologists, old cardiologists, and they were fighting over whether this was heart disease or not in a patient, okay? And it was, everybody had their own opinion. So I've been in situations where it's extremely frustrating to figure out exactly what's going on with the patient when you've got tons and tons of wisdom and mental clarity in the room. So anyway, we always going to take the high road. We're going to make sure you're fine. And certainly if you think there's something going on, let us know. We don't want to miss it. We just want to take care of you and get you taken care of appropriately. Okay. And the last thing I want to do, if you do get put in the hospital, we're going to try to keep you out of the hospital. Okay. That's part of our job. But if you do get put in the hospital, I want to see you as soon as I can when you get out, and I want you to bring all your meds so that we can reconcile them. Now, this is something that Medicare and the insurance companies have been pushing with us to do, and it's valid. Okay, in other words, that's a hot spot when it comes to errors, and they're addressing that, and I agree with it. I just need your cooperation as reaching out to us when you get put in the hospital and say, hey, I need to see Dr. Beck to go over my meds and make sure everything's fine, because I've been in the hospital and they started me on some new meds and took away some new meds. And you just got to be careful with that. And even when I worked in the hospital, I was very vigilant of what I was doing to the patient's med list upon it being put in the hospital versus discharge, because a lot of your meds, sometimes every single med you're on gets changed. And we just need to know about it so we can respond personally and specifically look to make sure there's not any med errors or redundancy or whatever it is. So anyway, it's there for you. We want to check in on you after you get out of the hospital, make sure everything's fine. And we just ask for your cooperation, just letting us know so we can get you in here and get you seen. And we often do find errors, redundancies, or something. The biggest issue we have is people not bringing their meds when they do that. And that's our number one task, is reconcile meds. So bring your meds so we can reconcile them and make sure we know exactly what you're on. Okay, we just don't want to guess. Okay, it's that simple. Thank you so much for listening to me today. Everything's going great. Place of Hope is going great. Everybody here, we've got a great team where they are changing. We're improving on things here. We're trying to pick the phone up within 3 minutes or 3 rings. We're trying to get patients back in a more efficient manner so that they can be seen and taken care of more efficiently. All those things we talk about every day, and we're working on it. We're going to make it better. So I appreciate your cooperation. You have a wonderful day, and call me if you need me.